Okay, so everyone, this is more or less how you will prepare Sculptra. Okay, so Sculptra comes in a vial, and the vial, as you see, has 367.5 milligram vial, and this is all the powder. So that's how it comes. So the first thing we need for it is sterile water. Okay, this is 10 cc sterile water, but what we're going to do, like I use 10 cc syringes, is I'll take 9 cc. Now it differs a little bit if you're gonna use it immediately, and I mean in the same day, or if you're gonna leave it in the fridge for a few days, like 1 or 2 days, 3 days, so that it mixes better before you inject it. Okay, and then this is, I add like 9 cc of sterile water, push all the way. I get the tip of the needle up away from the fluid, and I'll just withdraw very gentle, slow, okay, so that it doesn't draw any fluid back, and I'll try actually to empty all that air from inside. So it's good to mention here that the recommendation before, really in the past, was to mix it like 3 to 4 days before the injection, and then the newer recommendations to mix it like 24 hours before or so before the injection, so that all the particles, really, you see how it's clumps here, so basically we need all that clump to dissolve. Okay, and then the new recommendation actually is just to really mix it, and you can use it even half an hour or 1 hour before you inject it, if you really mix it and make sure it doesn't have any clumps, and you mix everything. Okay, so now that's what I was talking, and this is like a vortex mixer. Okay, and then you just press it and start mixing, and then if you notice, even the way how much pressure and how much and the angle how you mix it will make a difference. For example, if I do like this, it's mixing better, so you just find an angle and a pressure that you put in the mixer to make sure that it's really mixing the best way, and then you wait, and then you just have to really keep mixing, and sometimes you can shake it, and then you can do it upside down, whatever you need to do, and then from time to time, you know, you just keep looking, and you see that there's a clump here. I'm not sure if you can see it with the lighting, but I know there's a clump, I can see it, so I just have to keep mixing. So again, in the past, the lidocaine with appy, I mix like 1 cc, sometimes 2 cc. So if you do 8 cc sterile water, then you do 2 cc of this. If you make 9 cc of sterile water, you can do 1 cc of lido with appy, and then you can always go up and down. For example, if you're doing really large volume of Sculptra, then you don't want to mix more than 1 cc of lido with appy in each syringe, and even sometimes you have to go down to half cc, especially again if you're doing like 20 syringes of or vials of Sculptra, so that's a lot of appy, and it starts to get into toxicity level, so you can adjust to prevent that as well. Again, you keep mixing. Okay, and the idea again is just to make sure that you have no clumps. That whitish thing is cellulose, that's not going to go away, so that's not really the clumps and the particles of the Sculptra, but wherever you think there's part of the Sculptra, you need to keep mixing till it all dissolves, and then it's actually safe then to inject it and minimize all that, you know, mixing it before is just to prevent the forming of nodules. But honestly, you know, if you really mix it even the day off, half an hour before, and you really mix it well, then it's safe to use. If you have other opinion, if you have any experience, if you have any questions about the preparation of Sculptra for injection, you know, it's only how to prepare it. For patients, you know, Sculptra is really good. It's a collagen stimulator, it's not a filler, so it's good for botox augmentation, for the face as well, different parts of the face to give support because we lose volume, so it's really a great options for that as well. And there's some other you know, recommendations and uses for Sculptra. Some are on label, some are off label, for the skin and the sagginess and all that stuff, to tighten and texture, so it can be used for that as well. Again, for the injectors or patients, if you have any questions, you need more explanation about anything, please let me know. After I mix that, you know, what I'll do, even I can do it now because I have a patient that I'm gonna inject. So again, I'll take 1 cc from the Lido, and this is really very handy, you know, to have it in small ampules like this. And what I'm gonna do is, again, just release the air. I'm not gonna use this again, so I left a little appy, so I put only 1 cc of Lightwood appy, and then I'll mix it as well. So now it's a Sculptra particles and with the sterile water and Lightwood appy. So if you don't have sterile water, you're asking, oh, can I use saline? Yes and no. Yes, if you have to, but no if you don't have to, because you know the studies show it's still effective when you use saline, but the Sculptra particle dissolves better and work better whenever they're in a sterile water environment. So number 1 option would be sterile water, and number 2, if you have to, then you can use saline. Again, you know, I'll talk to you in the next video, and if you have questions about this one, please let me know, and please remember to subscribe to get more videos.